Ken Landau. Thanks for watching. Let's talk about Imitrex or sumatriptan. This is a drug for the treatment of acute migraine headaches. It's not a preventive. It's not for tension headaches. And it's not for headaches associated with loss of movement on one side of the body. The drug was patented in 1982, came on the market in the United States 1991. It's now available as generic drug. It's available as tablets or injection in a prefilled syringe, or it's available as a nasal spray. For a while it was available as a skin patch, but that was taken off the market because it caused irritation of the skin. The drug is in the triptan family. It boosts the level of serotonin in the system. It's indicated for acute migraine headaches with or without an aura in adults, and only if there's a clear diagnosis of migraine headaches. It's not indicated for anything else, although it's very frequently used for cluster headaches and works very well for cluster headaches. Other drugs in the triptan family include Zomig and Axert and Maxalt and Relpax and Frova and Amerge. Migraine headaches are painful. They're often debilitating. They're associated with disturbed vision and sensitivity to light and sound and smell, and sometimes people vomit or feel sick. Estimated as many as 18% of women and 6% of men suffer from migraine headaches, which means the toll is somewhere between 30 million and 35 million people here in the United States, with about 10% of school-aged children suffering from migraine, and half of the migraines occur for the first time in people who are less than age 12. Overall, the peak incidence is somewhere between about 35 and 39 years of age. Most people with migraines suffer a few each month, although more than 80% are going to suffer at least one attack each month. 50% of the people with migraine headache, unfortunately, haven't been diagnosed or were diagnosed as having tension headaches. The medicine is available at 25, 50, and 100 milligram pills. If you're going to take the medicine, well, you're going to get some benefit, but probably not complete benefit with just a pill. So you might need a second pill, but you're not allowed to take the second pill for at least 2 hours after the first, and then only if you've had transient temporary improvement and the migraine seems to recur, or it doesn't resolve completely. So you have to wait at least the 2 hours. Maximum dose in any 24-hour period is 200 milligrams. Now, if you happen to have mild to moderate liver condition or impairment, then you shouldn't take more than 50 milligrams at a time. Well, the question is, what's the most appropriate dose? And the answer is probably 50 milligrams is an optimal dose. 25 milligrams seems to work pretty well. 100 milligrams doesn't work much better than the 50 milligrams, but with a higher dose, you tend to get more side effects. Once you take the medicine, you should notice significant improvement within 3 hours. If you've taken it for your first migraine and you haven't had significant improvement, you should reconsider what the diagnosis is. Maybe you don't actually have migraine headache. Now, if we're talking about an injection instead of the pill, the injection comes in 6 milligram syringes. So you take the injection, and then you have to wait at least 1 hour, not the 2 hours, but at least 1 hour until you give yourself a second injection if you're not markedly improved. On the other hand, if you're significantly improved, you may switch to a tablet for your second dose. And again, you can't have more than 100 milligrams in the course of a day as far as the pill is concerned. The safety with more than 4 migraine headaches in a month hasn't been established. This isn't the medicine that you take every day or a chronic medicine. And if you need more than 4 times a month, you should be on some sort of prophylactic or preventive therapy. You could take the medicine if you want with meal or without a meal, but if you take it with a meal, it's going to decrease the absorption by about 20%. Now, all doses, 25, 50, and 100, they seem to provide greater benefit than placebo at 2 hours and at 4 hours. So if we look at people who have moderate to severe migraine headache and they take the medicine, what's the likelihood in 2 or 4 hours that they're going to have no more than a mild headache? Well, if we take any of the doses, the 25 or the 50 or the 100, it's going to be somewhere around 50 or 60, 65%. If we, at 2 hours. If we look at 4 hours, it's going to be somewhere between 65 and 80% going to be reduced from moderate to severe to no more than mild headache. And that's at least twice as good as with a placebo. And again, if we take the optimal dose, either say 50 milligrams or even 100 milligrams, still somewhere around a third to a half of the people are not going to be clear at 2 hours. If we look at an injection, well, probably only 20 or 30% of the people not going to be in pretty good shape. Now, if we look at the likelihood of a person taking the first dose and then needing a second dose, irrespective of what dose you took, probably about half of the time you're going to need a second dose, as opposed to about 2/3 of the people who were given a placebo need a second dose. So the injectable medicine seems to give us the best results as far as clearing is concerned. So we can go from a moderate to severe headache to no headache at all in 2 hours in about 60% of the people with an injection. And we go from the moderate to severe to no more than a mild headache in somewhere around 80% of the people who are given the injection, as opposed to about 30% of the people who take 50 milligrams of the medicine. So it would appear that the injection probably is going to give us the best bang for the buck. Well, how about the intranasal product? The intranasal product really is only for those people who can't take pills, maybe because there's associated nausea and vomiting associated with the migraine. So you use it intranasally, but it's not absorbed intranasally. It has to get into the gut, and then it's absorbed through the gastrointestinal system. And actually, there's even less absorption than with the 25 milligram dose of the pill. So there are no studies that confirm that a person who takes the migraine therapy early on in the headache, when the headache's only mild, seem to do any better than waiting until you have moderate to severely intense migraine and take the medicine. Most triptans in this family are pretty much about equal. But some people seem to develop mild migraines, and then they seem to progress in a stepwise fashion and get progressively worse. If that happens most of the time or all of the time, well, then maybe it's appropriate to start taking the medicine relatively early when the headache is only mild, because if the headache is only mild, the likelihood of being pain-free in 2 hours is about 60% versus about half as much, about 30%, if you had a moderate to severe headache when you took the medicine. But then you have to say, well, some people get mild headaches and they don't progress. So you're sort of on the horns of a dilemma. Are there any side effects associated with the medicine? Sure, lots of side effects. So it can cause facial flushing and tingling and cause warm feeling or cold feeling, sometimes even a scalding feeling. In some people it causes pain or vertigo or muscle tightening or palpitations, or some people become tremorous. But interestingly, some people complain of chest or throat or jaw or neck tightness or pressure or heaviness or pain, and they're worried that maybe that's associated with cardiovascular disease. Well, the medicine may be associated with cardiovascular disease and worsening of symptoms, but those symptoms that I just mentioned don't seem to be. They seem to be non-cardiac. Other times, it can make your blood pressure go up, make your blood pressure go down. And in rare cases, as I said, it may be associated with either arrhythmias or a heart attack or a stroke. Sometimes with the injection, you get very high levels of serotonin very rapidly, and that can lead to a significant number of problems. It can lead to agitation and hallucinations and fever, can increase the heart rate, cause overactive reflexes, and cause people to have nausea or vomiting or diarrhea, loss of coordination. And sometimes you have an arrhythmia, and especially in people who are predisposed to arrhythmias, there's some risk. But for overall, the chest, the tightness, the throat pain, all of those symptoms are not associated with cardiovascular problems. We have to be a little more careful in elderly individuals or in those people who have a history of cardiovascular disease. So people who have diabetes or high blood pressure, people who have had a stroke or had a transient ischemic attack, people who are overweight, obese. Those people seem to be at higher risk. And people who have some sort of history of vascular disease, peripheral vascular disease in the leg, vascular disease in the belly, ischemic colitis. Those people are more at risk for developing problems. And then there's a problem with, well, can the medicine cause some reduction in vision, even blindness? Well, it seems that it probably is the migraine headache or a stroke that's developing rather than the medicine itself for the overwhelming majority of cases. And then it can make a person prone to seizures. So if you have a history of epilepsy, or if you're taking medicines that reduce the threshold for seizures, you do have to be a little bit careful. And since it can elevate the blood pressure, well, you have to be a little bit careful, make certain that the blood pressure is well controlled. If you take the medicine, it can by itself lead to the serotonin syndrome, but especially likely if you happen to be taking an antidepressant, maybe SSRI like Prozac or Paxil or Lexapro, or maybe you're taking a tricyclic antidepressant, MAO inhibitor. In those people, that can cause marked problems. It can cause problems ranging from nausea and vomiting and diarrhea to agitation, hallucinations, labile blood pressure, and even coma. So do be careful. And if a person has a history of multiple migraines in the course of a month, there's a tendency to overuse these drugs. And you can overuse the triptans or the ergotamines, and you can overuse just simple aspirin or the non-steroidal anti-inflammatory drugs, and you can develop chronic daily headache, not because of the underlying migraine, but because of the overuse of the medicines, including the Imitrex. So do be careful. Limit it to 4 times a month. And sometimes the early manifestations of a stroke or hemorrhage into the brain, a subarachnoid hemorrhage kind of a stroke, they can be mistaken for a headache. So if you have a headache and it's not your typical migraine, then you want to talk to the doctor. Well, if a person has taken another one of the medicines that alter the serotonin metabolism, you have to be careful. So you shouldn't take Imitrex within 2 weeks of taking an MAO inhibitor. You shouldn't take it in close order to taking dihydroergotamine or Cafragot or methylsergide. You should wait at least 6 hours or even more, because they all have a tendency to constrict the blood vessels. And you certainly have to be careful if you have a history of any of those cardiovascular problems I mentioned, coronary artery disease or peripheral vascular disease or uncontrolled hypertension, ischemic bowel disease, or any of those things. You have to be extra careful. And if you happen to have a migraine and it's associated with paralysis or weakness of an arm or a leg or vertigo or difficulty speaking, this isn't the drug for you. And interestingly, in dog studies, it's found that Imitrex leads to corneal opacities and corneal defects. We don't know what the significance of that is. Well, how does the drug work? The drug seems to work on the serotonin metabolism. It boosts the level of serotonin. It seems to act on the intracranial blood vessels, and it seems to have something to do with the sensory neurotransmission in the trigeminal nervous system. Well, interestingly, it can also decrease the level of pro-inflammatory neuropeptides that are released from the brain and the nervous system. Structurally, it's similar to serotonin, and it might actually work on the calcitonin gene-related peptide the way that some of the prophylactic medicines seem to work. It also seems to decrease the activity of the trigeminal nervous system, and that seems to be the way it works in the cluster headaches. If you're pregnant, can you take it? Well, we know that women who have migraine headaches have an increased risk for preeclampsia, and we know that in animal experiments, well, the drug caused significant fetal abnormalities and death. But in the Swedish migraine study, it was really a non-significant to maybe a slight increase in the malformations in the U.S. pregnancy registry. Seemed to be no overall increase in the incidence of pregnancy-related problems, but there was a smidgen of an increase specifically in ventricular septal defects, a hole in the bottom part of the heart, and pyloric stenosis, where there wasn't an open emptying of the stomach into the intestine. In lactation, well, some of it certainly can get into the breast milk, so it's probably best if you wait for about 12 hours after you take the medicine until you resume your breastfeeding. Pediatrics, not appropriate for under age 18. It's been tried in people between the ages of 12 and 17. Side effects no different than adults, but it doesn't seem to work to relieve the migraine headaches. And as you get older, we have to be careful because all of those conditions with the cardiovascular system, they tend to increase in frequency. So we start with a lower dose, but we check the older people to make certain they don't have any pre-existing risk. Well, the bioavailability of the medicine is very low, only about 15%. It gets into the system, it's incompletely absorbed, and it's metabolized before it even gets into the systemic circulation. The elimination time is only about 2.5 hours. That's the half-life of the drug. So that's why when you get the improvement, well, oftentimes the headache seems to flare up after about 4 or 5 or 6 hours, up to a day later. Then you might need the second dose. Well, elimination is 60% through the kidney, 40% through the liver. The protein binding is only about 20%. That means 80% of the medicine that's in the system is actually circulating around. It might do something. How much is in the system? Well, if you take the 25 milligram dose, you'll have, let's just call it 18 units in the system. If you take a 100 milligram tablet, that's 4 times as much, you're only going to have about 50 units. So that's less than 3 times as much, even though you've taken 4 times the dose. If you take the nasal spray, you'll have only about the same amount as if you took the 25 milligram pill, even slightly less. But to boost to a relatively high level, you'll have about 70 units if you take just 1 injection. So there is no question. If we're talking about how much gets into the system, the injection, it works much more quickly. Actually, it works is in the system within about 10 minutes as opposed to about an hour and a half if you were to take the pill. Now, the likelihood of improvement is not significantly different if you have an aura versus you don't have an aura. Supposedly it's not different whether you have a mild headache versus you have a moderate to severe headache. Doesn't seem to be affected by your age, your weight, your gender, relation to the menses, and even doesn't seem to be related to the concentration in the system. Well, how about some independent reports, consumer reports? They say for the less frequent migraines, less severe migraines, acetaminophen or the non-steroidal anti-inflammatory, or even Excedrin extra strength that combines aspirin and acetaminophen and caffeine, that might be sufficient. If you're going to take triptan, they say sumatriptan probably is the best, cheapest. That's what they call their best buy. American Academy of Neurology, American Academy of Family Practice, they say for mild to moderate migraines, stick with the over-the-counter or the prescription non-steroidal anti-inflammatory drugs and only use the triptans for severe disabling migraines. The Canadian Headache Society has some guidelines. They strongly recommend any of the triptans, or for that matter, they also recommend aspirin, ibuprofen, naproxen, diclofenac, acetaminophen. They say we're a little bit cautious about the ergotamine, dihydroergotamine, codeine. Stay away from tramadol, stay away from Fioricet and drugs like that. Stay away from Stadol. But interestingly, they say, the Canadian Headache Society says, if you take a 10 milligram Reglan and you take some acetaminophen, that's going to give you the same amount of benefit as taking 100 milligram Imitrex, and going to be a heck of a lot cheaper. Well, the Cochrane collaboration, they evaluate drugs, they evaluate the studies available. They say that the likelihood of having no pain if you take 100 milligrams of the Imitrex, no pain at 2 hours, about 25% of the people versus 8% with the placebo, and you can have no more than a mild headache in about 60% of the people at 100 milligrams versus about 30% with the placebo. So significant benefit. So Imitrex was the first available triptan. It cost $25 a pill up until about 2009 when it went generic. Now you can buy the drug 9 tablets at 50 milligrams, cash price $45 low to $260 high. With a coupon you can get for nothing at GoodRx. The drug costs $6, but if you go to Target or CVS or Walgreens, it's going to cost you somewhere around $63 with the coupon, but the brand name drug going to cost you about $600. Now, interestingly, they came out with a product known as Trexamet. And Trexamet combines Imitrex at 85 milligrams with 500 milligrams of naproxen. You can take 2 pills in any 24-hour period. You shouldn't take the second pill within 2 hours of the first pill. It seems to work better than naproxen alone, but it doesn't seem to work all that much differently than Imitrex by itself. And interestingly, the cost of Trexmet, if you want to go get the brand name, it's $1,000. That's an awful lot of money. The cash price for the generic is somewhere between $600 and $900, and with a coupon, it's $200 to $400. If you want the nasal spray, go over to Walmart for cash, it's $300. If you go over to Walgreens, it's $700. But with a coupon, that comes down to somewhere between $112 and $240. The name brand product is about $500. If you want probably the best acting, which would be the injection, you can get 2 vials, and the generic cash price is going to be between $80 and $160. The coupon price between $20 and $65, with Walgreens being at the top. The brand name is going to be about $400. So there you have it, basically. That's Imitrex, belongs to a family of drugs that we frequently use to treat migraine headaches. The triptan family, all of the drugs in the family work very well. The injection seems to work better than the pill. Some believe the sooner you take it, as it gets to be at least a moderate headache, moderate in intensity, then probably the better it's going to work. Other people say, no, you just wait till it's moderate to severe, then you take the medicine. But there are precautions because, remember, the drug's associated with some significant number of side effects. And if you have more than 4 migraines a month, you should be on some kind of prophylactic or preventive therapy. We have shows on most of those preventive therapies available. And anyway, if you enjoyed the show, please tell a friend and consider subscribing so you won't miss out on any of the new episodes. And I appreciate your time. I'm Dr. Ken Landau.